All right. Hi, everybody. My name is Dr. Ian Shtulman. I am excited to be joined by Dr. Barry Lowy. Doc, thanks for being here tonight.
Hey, thank you for having me.
I wanted to have this conversation with you because I know last night you did a Facebook Live conversation all about coronavirus and what we're looking at in terms of the latest research. But I noticed, and I'm sure you've noticed the same, is that there are a lot of parents and a lot of individuals who are really fearful right now. They're obviously concerned about the coronavirus, but more importantly, they're concerned about what they can do and how can they best protect themselves and their family. And I thought we could have a conversation about what are some simple things that we as providers might recommend and can help people give themselves the tools to support themselves, not only with coronavirus, but in terms of any viral infection.
Absolutely, for sure. Uh,
So I was just going to ask, give me a quick review, a summary of kind of what you covered last night.
so basically, we went through the epidemiology, how many cases there were going on, how many were pediatric, then went through some scientific discoveries that were released, still limited information from China. France is putting together some things, Japan as well. And, there's a lot of countries working around the clock to try and get some information out. And I just really wanted to level the playing field to make sure that people understood that the surveillance that has been done is not what we're looking for. And that was really the biggest talk about it. The biggest point is what was screened and what has been screened in the state of Florida and throughout has been people who have shown up to the emergency rooms and were really sick. And so
Yeah.
those are the ones that they did test. They tested, I think, a little over 2,000 people at that time in the state of Florida. I went through some numbers of positive cases in 3 of the counties, Miami-Dade, Broward, and Palm Beach County. And I just wanted to really let people know, hey, it's very mild disease case, really dealing with anybody above infancy and going on through 75 years of age, just about there. And if you do have the complications from heart disease, diabetes, and respiratory, they're not including asthma. We're talking COPD, we're talking sarcoidosis, cystic fibrosis, other scenarios that are going on there in particular, because when you look at asthma, just for say quickly, anything can trigger that itself.
Sure.
And you're working on that as something else. So sure, coronavirus, any virus could trigger it.
Well, I think you bring up a really important thing, which is, what we're going to see is the number of cases are going to rapidly increase as far as confirmed cases, right? We haven't been testing widely in the US. It's been one of the big controversies. One of the reasons why we have such a widespread social distancing policy is because we haven't been testing. So we have to assume that everybody is contagious. And the reality is, once we start ramping up the testing, we're going to see those numbers are really going to start to increase. And that doesn't necessarily mean that the virus has rapidly evolved. It doesn't necessarily mean that people are getting so much more sick. It just means we're actually confirming those number of cases that are there. Because you're right, right now, the number of cases that are primarily being diagnosed are the ones that show up to the ER with advanced pneumonia, the people who need the intensive care. I've seen a couple people over the course of the last week with symptoms that match up with coronavirus, but they've called their doctor and their doctor says, we don't have tests, so don't bother. Just stay home and take care of yourself. And unless things get really bad, just try to manage this at home. What would you say to a parent who called up, or just anybody in general, who thought they might be experiencing some of the symptoms of coronavirus, cough, fever, shortness of breath? What would you recommend that they do? And at what point should they seek medical attention and try to get a confirmed test?
Yeah. So basically with coronavirus, like the others, the big 3 would be fever, runny nose, congestion, coughing. When you're talking about, hey, we really need to be seen, is going to be where you have respiratory distress, shortness of breath, elevated fevers, maybe for a couple of days that aren't responding to other ways of treating. It doesn't necessarily have to be Tylenols, Motrins. It could be trying to cool them off in a lukewarm bath. It could be toweling them off, skin to skin. This depends upon the age. and things of that nature. So, if things are elevating, let's just take a case. Let's just say that this is a 4-year-old. So if it's a 4-year-old, we know that they're not going to be so easy to stay hydrated. So you're looking to make sure they have 2 to 3 wet diapers. And this sounds very familiar in the way that we deal with everything. So kind of urinating at least 2 to 3 times in the day. If they're wearing a pull-up, typically at nighttime, that will be full. So you're making sure that they're just not sleeping throughout the day and they're hydrating themselves.
Yeah, that's a really good point. I mean, the main thing that parents should look out for if their child has a fever or if they have a fever is if the child or the individual is staying hydrated, if they are, urinating regularly, if they are making eye contact and responsive, and they seem to be breathing fine. Those are all signs that a fever is helping the immune system fight off the virus or bacteria. But if it ventures into an area where kids are not responsive, or if they're struggling, or if people are having difficulty breathing, that becomes a different situation where it's appropriate to seek medical attention. And I know you and I are on the same page in terms of doing our best not to suppress the immune response, but rather support the immune response by, like you said, hydration, skin to skin contact, and just overall keeping comfortable, as opposed to necessarily interfering with the with the immune response with medication.
Absolutely. A lot of things that we do tell people to go off and go do. A lot of times, we'll have families who, hey, you know what? There isn't anything. We've seen them. We're telling them it's a virus. And some of them will do elderberry. Some of them will do echinacea golden seal. Some will say, hey, I'm going to go see my homeopath. I'll see my chiropractor. I'm going to do things that will enable me to create a response, resting, eating well-balanced meals and things
Yeah,
that
that help the immune system as opposed to treating the fever.
absolutely, because fever is really important. Without the fever, you're not creating the response throughout your body. That's one of the uh, first responses that occurs and then sets off the acute phase responses and stuff like that, right? Your tumor necrotic factors, your interleukin 7, 6s, that will go off and then start telling the cells what to do. So hence why you don't necessarily want, right, when we talk about Tylenols, Motrins, lots of studies, I know we've gone over it so quickly in the sense, so Tylenol itself, right, depletes glutathione. And when we're going to just chat about this in the aspect of coronavirus, right, the COVID-19, they're making recommendations from the French government, from their health department there. They basically have stated that they've done enough research and shown, and which all immunologists know, and as physicians too, as we've studied these things and how the immune system works, that the paradigm that they're creating for ibuprofen and saying not to is that the non-inflammatory aspect to it is going to exacerbate the pulmonary issues. So I went through the articles, and the big thing is there's no 100% proof on this. It is all hypothetical at this moment in time, but makes sense. They had 4 cases over in France that were pediatric cases that as soon as that doctor started using ibuprofen, it did inflame the lung disease, creating more additional pneumonias. They cited the cases. It's not of coincidence. So yeah, people need to think about what they are using. There's lots of credible other articles that are out there about ibuprofen linking exacerbations for asthma patients and so on and so forth. So right now I would use and heed caution against doing that. They did claim that if there was something and a parent did want to use it, say to lower down fevers, if they did want to use acetaminophen, that was the one thing that they said would not exacerbate. So.
Yeah, I mean, I think obviously they've talked about how ibuprofen is something that we probably shouldn't be using for coronavirus. And I would say that parents in general should do their best to support their child's comfort and help make sure they stay hydrated, and really confer with the doctor on the child's behavior if they need to do anything medically to lower the lower the fever. But overall, I think most parents would be better off trying to really understand what their child's body is trying to do and supporting it rather than interfering with it. Now,
Agreed.
one of the things that I think I've been talking about with my patients is that there's two things that are required for people to get sick with any sort of illness, whether it's viral, bacterial, or this particular coronavirus. The first is exposure, and then the second is a susceptibility to that infection. And I've been using the analogy that if I had a handful of seeds and I walked outside and I sprinkled those seeds on the ground, some of the seeds are going to land on the fertile soil, and they're going to be in the right environment with the right nutrients and the right water and the right sunlight, and they're going to grow into their potential. But some of the same seeds with the same potential are going to land on the rocky terrain that aren't going to be in the right environment, and that's going to lead to no growth, right? It's not going to turn into anything. We know that some people get exposed to viruses or bacteria, and because their body is the rocky terrain, that inhospitable environment, that virus and bacteria can't take hold and can't grow into anything. So what do you recommend to parents in terms of helping them become that rocky terrain, helping their bodies to become a stronger resiliency, less susceptibility to not just coronavirus, but all infections in general?
Yeah. So I think nutrition is really the biggest step I do. I always tell parents, and it's kind of funny when I'm talking with them, I'm like, we weren't born with vaccinations. And of course, as they're creating a vaccine for this, right, that's kind of part of the allopathic picture of protection. And it's about what you're eating and stress levels and that nature. So you need to have your veggies and your fruits. You need to be well balanced. You have to have your water. You're made out of over 75% to 80% water. So these are things that you need to do. You need to de-stress, take the time. Stress will create an inability in your body to do those things. Some of the other big things to do outside of that is, hey, maybe take a probiotic. If you really aren't eating well enough, you could do those things. An exercise program, just kind of like you mentioned, to kind of build that up. Some of the other things that some people like to do, it was interesting, I was kind of looking into it, was nasal irrigation, right? So some people do
like a neti pot.
Purpose. Yeah, people will do that prior to being sick, or they feel like, hey, this is a practice that they use for themselves that will kind of keep and flush the nares out. And kind of going from there. So, that's really what I do suggest. And then, of course, using common sense, all right, washing your hands and, if you felt like you were exposed, kind of going those ways. But really, I'd say those elements that I described are really the basis and the foundation.
Yeah, I would add to that. I definitely agree as far as the probiotics. I would also say that one thing that we're sorely missing is vitamin D. Normally we produce vitamin D through the sunlight, but especially in South Florida where the sun is so strong, most of us either try to spend time indoors or we try to cover up with sunblock or long sleeves. And, especially people with fair skin like myself, our vitamin D levels tend to be lower. And vitamin D is really important, not just to prevent things like rickets, but to actually support in the immune process.
Absolutely.
I know the Vitamin D Council recommends doing 1,000 IUs per 25 pounds of body weight. I think whether or not somebody wants to supplement with that much on an ongoing basis, it's probably a good idea when we're worried about cold and flu season or coronavirus season, so to speak. So I think that's a really good idea. But I think, when you mentioned the stress levels, that I think is so important, because what I'm noticing right now, and you'll resonate with this being from Florida as well, whenever there's a hurricane coming, there's a difference between being aware of it and preparing and taking action versus watching the news 24/7 and being in absolute panic mode about it, right? And I feel like right now, between social media and between the 24 hours news stations, people are so oversaturated with information about this coronavirus that it's actually causing people not just to be prepared, but to actually be panicked. And the problem with that is when you're aware of something, you make decisions, your body shifts into like a sympathetic state that allows you to make decisions to protect you and your family. But when you're in a state of panic, it leads to irrational decisions. It leads to fear that actually creates stress that's damaging to your immune response. It makes it so that you don't sleep. It makes it so the body just starts to shut down. And I fear that a lot of parents, as this coronavirus is starting to spread more, that we're actually doing more harm by being so fearful over what's going on. What sort of things do you recommend that parents do to try to be aware, but not necessarily be freaked out?
Well, just I think that I talk to them about this as being any other virus. I get that we don't know it, and that is the unknown to it, but it is in mild cases that we really are seeing, and people are living right on through it and everything else. And you've
Yeah,
seen videos of people who were hospitalized and being like, yeah, or they stayed home, isolated themselves, and then they would describe their events. So, I mean, we're getting a lot of case results that come through, and a lot of it is a very mild upper respiratory infection that kind of comes and go. And I just let them know, I'm here for you. We're here for you. I work over at Sites. So at Sites Pediatrics, the things that we're doing is we've created telemedicine so that we can now start having real conversations, seeing people, not necessarily diagnosed, but at least to have face to face and maybe look. And that's a better way of approaching it than talking on the phone. That kind of can alleviate a little bit of stress because now you can see a face. You can
yeah,
see me. I could possibly take a look at something that might be going on with the child. That's one thing. We've set up other things just as other offices to working through what the CDC recommendations are and how to proceed with other people that might feel. So they should know that things are being done appropriately. It is not necessary to sit there and swab everybody. That's not the game point, because even if you did have this, that doesn't mean to do anything different.
yeah.
So it's for people to understand that this is just it's a viral infection that is out there, and we're learning more about this. And as much as the way that the government is going about it with the social isolation and shutting down businesses because people aren't taking care of business. People were showing up to the beaches nonstop. People are going out, hanging out when the government was telling you, please don't go into 50 people groups. And then they start shrinking the numbers, so the idea is ownership and responsibility for ourselves. And once you start doing that and you do take care of yourself at home and your family, there's nothing to panic about. It's
Yeah.
just knowing that you have an ability, if you have questions, and not to go Googling them up, and to actually contact your provider and contact you, contact us.
Yeah. Yeah, I think people really need to get that the overwhelming vast majority of people who contract coronavirus will recover with mild self-limiting type of symptoms. And this isn't something that is catastrophic for most people. Obviously, you mentioned that people with pre-existing conditions need to be particularly concerned. And I think the people who are most at risk, the elderly, people with previous cardiovascular issues, people who would be really susceptible against any viral infection,
Exactly.
uh, need to take precautions, right? So for instance, my kids aren't visiting their grandparents or their great grandparents, during this time, because we want to help to isolate the people who are most at risk, give them an opportunity to stay protected. But the vast majority of us, we should do our best to create the social distancing to reduce the transmission of these cases. But
Exactly.
that doesn't necessarily mean that you need to board yourself up in like a panic room, right? Or a bunker.
You get to
Uh,
live.
yeah. We need to, what we've been doing as far as our family is we've been going out, we've been taking walks outside in the neighborhood. We're cutting down on social media so that we're not obsessively looking at every update. We're trying to increase our physical activity. My kids are doing like Cosmic Kids yoga on YouTube during the day. One of the things that I've been recommending to a lot of families is to do meditation or breathing exercises. This is to help mitigate the stress levels. You can do obviously the supplements that we talked about, getting good rest. I think, most parents who are concerned about this are doing things right, but I want to make sure that everybody out there takes appropriate action to take care of themselves, but don't necessarily create so much stress in their lives that they actually become more susceptible to complications because of that stress.
Agreed. And if they do feel overwhelmed, they need, I'd say give us a call. Call your
Yeah.
provider, talk it out, speak to them. That's what they took a hypocritical oath for. So that's what's going on, as being practitioners in the medical society, we're here for people.
Yeah, we'll talk sense into them.
Exactly.
The one other thing I'd like to add is from a chiropractic perspective, I've noticed that people who are better adjusted tend to be able to better handle their stress levels, and they also have a stronger immune response. And I think one of the things that we tend to do is, we want to protect ourselves, but we sometimes try to distance ourselves from people so much that we actually forget about the things that allow us to stay healthy and allow us to take care of ourselves. So I just want to remind people that visiting your chiropractor will actually help strengthen your immune response and allow your body to better handle not just this, but any sort of illness.
Yes, agreed. And one of my other thoughts was I've seen some articles, and I figured I would just touch on this. Um, there's been some things that deal with essential oils, people using them, and I found a couple of things that was kind of interesting dealing with some people who were diagnosed over in China. And as much as they're saying, hey, don't use these essential oils, everything else, from thinking like you can cure these things, I think they do have a place, to help open up the airways. And one of the things, and I am definitely not a professional with it, is to use the ones that are non-irritating. So I don't know if eucalyptus is irritating or not. I think speaking to a homeopathy doc, somebody who's experienced with those things, and especially if we're talking about 1 year and under and you want to use diffusers, they have to be, certain ones could create neurological issues in the sense of seizures is what I do know. But otherwise, that's what I've read into for the COVID-19 with essential oils. Otherwise, elderberry, I know you gave me some fantastic articles on that dealing with the flu. And that
Yeah.
might be something that people might want to look into. I mean, you can kind of create that own little hypothesis that they could possibly start taking that almost like with the vitamin D type of scenario in prevention, right? The vitamin D should prevention too with the flu as well, right? Having those. I think that was pretty much it that I had that I did some research on, but I think just using the common sense things that we were talking about and connecting with your provider who you trust.
Yeah.
So they picked us.
Yeah, it's so important because in the same sense that if a family got sick with a cold or the flu, they're going to do certain things to help strengthen their immune response and better take care of themselves, right? By mitigating some of the symptoms, whether it's essential oils, whether it's supplementation, whether it's chiropractic, yoga, whatever it is. You do things because you notice that it helps to allow your body to better respond and better adapt to the stress load that your body is taking, whether it's a physical stress from being stuck in the house all day, whether it's an emotional stress from all the stuff that's happening around us, or even the chemical stress as far as being exposed to new novel viruses, so to speak. Do the things that allow your body to stay healthy, right? The things that you were doing before, keep doing them. They're going to support you. And remember, most people who develop coronavirus are going to have mild illnesses to the point that we probably don't even have a confirmed diagnosis on them. And it's the people who start to experience the respiratory distress where they need that medical attention. Save the hospitals for those people, right? Please, if you have mild symptoms, reach out to your pediatrician, do the things to support you, but don't rush off to the ER and clog the system, because you want them to be available for the people who have serious complications. It's one of the reasons why Even for the people in my practice who don't necessarily partake in a lot of medical care, I still strongly recommend that they have a good pediatrician that they trust and have a relationship with, because it's important for them to have somebody as a consultant, as an advisor. So reach out to that trusted professional for you, and then just do the things that help keep you healthy. That's kind of like my main takeaway message for most people.
Sounds perfect. Thank you for all that insight and having me on tonight to talk with you.
Yeah, my pleasure. I appreciate you being here, and I'll see you at your next appointment.
You got it. Thanks a lot.
All right. Bye, everybody. Thanks for joining.